Good evening and welcome to 6 p.m. Prime. I'm Pooja Shali, the show where I bring issues that matter to us as citizens of this country. And today we will discuss the issue that everyone's been talking about, monkeypox, that experts say no need to panic but do have caution. Let's begin first with the headlines. Bengal Chief Minister Mamata Banerjee breaks silence finally over Partha Chatterjee's arrest. Says she stands against corruption. ED claims the Bengal minister is faking his illness to evade questioning. Big news, 4 Congress members of Parliament have been suspended from the Lok Sabha for waving a placard near the Speaker's chair. Marikam Tagore, Jyoti Moni, Ramya Haridas and T.N. Pratapan have been suspended for the entire duration of this monsoon session. Karnataka Congress Chief Minister's Nataka is exploding. Party is now mulling action against MLA Zamir Ahmed, who openly supported Siddaramaiah against D.K. Shivakumar. He now says Muslims also should get an opportunity. Draupadi Murmu has now taken oath as the 15th president of the country. India welcomes its first tribal president. Draupadi Murmu recounts her roots in her maiden speech.
मैं द्रौपदी मुर्मू
ईश्वर की शपथ लेता हूँ कि मैं श्रद्धापूर्वक भारत के राष्ट्रपति के पद का कार्यपालन करूंगी.
A shocking bid to disrupt communal harmony amid the Kanwar Yatra in Uttar Pradesh's Bijnor. 2 attackers donned the saffron robe and that destroy a tomb. They have now been arrested, identified as Kamal and others. It's a big breakthrough in the Bollywood power couple Vicky and Katrina receiving a death threat case. The accused has been nabbed. He wanted to marry Katrina Kaif and had been harassing her on social media, especially ever since Vicky Kaushal and Katrina Kaif got married. So there is another suspected case of monkeypox that has now surfaced in the state of Telangana. It's suspected now. They have sent the sample as well of the patient. This is a 40-year-old man from Indiranagar colony in Telangana's Kamareddy district, and he does have symptoms of the monkeypox. He's now been shifted to Hyderabad's Fever Hospital. It is now known that the man developed fever on 20th of July, post which he later developed rashes and was then admitted to a private hospital. Now, this person arrived from Kuwait on 6th of July, which means he does have foreign travel history. He then came in contact with 6 people who are now also have been isolated. Delhi, meanwhile, the national capital has reported first case of monkeypox on Sunday. This is 4th after, remember, the previous 3 being reported from the southern state of Kerala. A 31-year-old man with no foreign travel history was diagnosed with the disease after having fever and skin lesions. The patient is being isolated and seeking treatment in Delhi's LNJP hospital. So 1 case in Delhi, 3 in Kerala. So let's go one by one. Remember, the recent case confirmed was from the national capital, Delhi 1, who did not have, in fact, foreign travel history, and that is now leading to who could he have come in contact with. But he was traveling within the country. Now, from the state of Kerala, 3 people have been and were the first to have been confirmed with the monkeypox symptoms, and in Telangana there's been a 1 case of suspected case for now. So officially we stand at 4. Doctors are analyzing if the Telangana case is also monkeypox. My colleague Milan Sharma has been speaking to medical experts and she now gets us the latest on that. And Milan, at this point, and before I go across to her, it is important to also tell our viewers that, remember, the World Health Organization has already declared the monkeypox right now itself as a global health emergency. It's given advisories also, but for now, India comparatively is at a much lower level of cases, so there's no need to panic or alarm, but it is important to be alert. And that is why in this special telecast, I'll take you through one by one about how in Kerala with 3 cases, Delhi in 1, India stands at about 4. So what are the symptoms? Take a look on your screens here. If you have fever and headache, if then you develop sore throat and cough, also if there are any sort of skin rashes that start to appear, any boil-like symptoms on your body, if there's a back pain and muscle ache or any body ache that you think is beyond or does not seem the usual ordinary exhaustion that you appear to be facing, perhaps it is then time with the exhaustion that continues and the rashes also. Rashes are primarily which does start to have on the body, and that is swollen lymph nodes, even on palm, as the doctors are suggesting who we have been speaking to. If these are the symptoms that you start to face, that is when you need to immediately isolate yourself or contact the nearest doctors. Now remember, some of these rashes or lesions on the whole body are painful according to the doctors who have been analyzing the cases. Now remember, in other countries, even in the United States of America, Canada, across Europe, the cases have gone in hundreds. So India stands only at 4, and we do hope it does not increase, and that is why it is important to already stay cautious of it. Milan Sharma now joins in with the latest on that. Take a look at this, the difference between monkeypox and COVID, because this is a question that has constantly been reiterated. Many people are asking, Milan, at this point that India stands at 4 cases, compared to several other nations reporting a higher number. What are you picking up from the LNJP case, 1 case that is being currently treated, about Kerala? Because if there's no foreign travel history, what are the experts saying to you about monkeypox? Do we need to be alarmed, Milan? The viewer watching this right now would have that question.
Well, Pooja, definitely, because of the fact that there have been so many cases of monkeypox reported in the European countries and outside of the endemic countries, now with 4 to 5 cases that are being reported in India as well, another fresh incident in Telangana as well, with the Delhi case as well. We are looking at the way to investigate whether monkeypox is now spreading within the community. Because remember, you and I both know that this particular person who is being treated in Delhi doesn't have an international travel history, but he seemed to have attended a party or an event in Manali. So whether he was in contact with those people who had traveled abroad, that needs to be investigated. Contact tracing of this disease will also be difficult, because you will not know you are infected with monkeypox unless you develop scabs or pustules on your skin. You may have fever, and 5 days later you will actually start showing the real symptoms of monkeypox, because the incubation period is longer. So that would take about 2 weeks, and then you will be cured after 4 weeks. That is a big concern. Also, with the WHO flagging that men are at a high risk. So men should be careful, because WHO has also said it is spreading more in males, also spreading more in the LGBTQ community. So that is where the risk of contracting monkeypox is higher.
That's an important point that you have mentioned, Milan. And remember, all of what our reporters are saying, or what I've been mentioning, has come from official sources, from medical experts, from doctors who are treating these cases, or of course have been researching on it. Milan, thank you so much for tracking all the latest, and we do hope that the numbers do not increase across India, and that is why it is important for you to understand why the WHO, the World Health Organization, has already declared an infection, a public health emergency that monkeypox is. India Today's Sneha Murdani decodes now what exactly is a public health emergency of international concern, and that amid this, with the monkeypox outbreak that has emerged. What does it mean for India and the world? Here's more coming up.
The World Health Organization has triggered the highest alert yet again. Monkeypox, now prevalent in over 75 countries, is a public health emergency of international concern. The second disease to be tagged so in 3 years. But what exactly is a public health emergency of global concern?
A public health emergency of international concern is defined as an event that requires the whole world to sit up and pay attention. It must be a disease or a health condition that is sudden, unexpected, goes beyond a country's borders and requires a coordinated response from multiple nations all at once.
The WHO's 16-member emergency committee has declared global health emergencies 6 times in the last 14 years. Of the 6 times that the World Health Organization declared public health emergency of international concern, only twice did the infection outbreak move to the pandemic stage. Once in 2009 with the H1N1 flu pandemic, the second time in 2020 when COVID-19 was declared a pandemic. In 2009, WHO declared H1N1 or swine flu, also known as Mexican flu, a pandemic. In 2014, polio virus was declared a public health emergency with an increase in cases of wild polio cases. Again in 2014, Ebola was declared a public health emergency of international concern. Same with Zika virus in 2016. Also in 2019, Ebola was again declared a public health emergency of international concern. The last time around in January 2020, COVID-19 was first declared a public health emergency of international concern and then a pandemic. But is monkeypox going to assume pandemic proportions? Will there be widespread infections and lockdowns? Should we brace for the worst? Experts say that this is not a lethal disease. The death rate is low and that this is not COVID. COVID is airborne. Monkeypox spreads through prolonged physical contact with a patient. COVID is more transmissible. Monkeypox is not highly transmissible. COVID invited mass lockdowns. Monkeypox is unlikely to lead to lockdowns. No wildfire spread expected in monkeypox. COVID, meanwhile, continues to see wide transmissions. The concern is that even though not very transmissible, the infection will percolate to the general population eventually.
Men who have sex with men, and this virus is spreading along these networks, and it's important to realize that these networks don't exist in isolation. These men could have multiple other partners. Many of them could have a regular family.
Experts also say that this is the time to change the nomenclature and ensure that stigmatization does not take place.
Stop calling it monkeypox. Declare this as a sexually transmitted infection. It is not spread through respiratory means like COVID. So the attention will be focused on sexual transmission. Currently all 100% cases are sexual transmission. 99% are male to male and 1% male to female or female to female. So in that kind of situation, we should declare this as STI.
So far, monkeypox doesn't look like causing a pandemic, but health bodies worldwide are keeping a close watch. In New Delhi, Sneha Mordani for India Today.
We've all been around the COVID pandemic for the past 3 years, and while we're aware about the coronavirus, I know many people are wondering if coronavirus and monkeypox are two similar things. It's not actually. So let me help you bring the differences between the COVID-19 and the monkeypox. Let's begin. We know that the coronavirus spread is caused by an acute respiratory syndrome, which means it primarily affects your lungs. Monkeypox is caused by orthopox virus and has nothing to do with the lungs or impact. There is no oxygen that is going to be impacted. This is what the doctors have clearly told us as a difference between the coronavirus and the monkeypox. Let's go on to the next slide about what exactly is the difference. Now, this is very pertinent. COVID-19, the coronavirus spread, is easily transmissible, which means it spreads fast and wide, while monkeypox is less transmissible and it has to have a skin-to-skin contact or physical activity or very close to likely the bed linen of another infected individual that it will spread at a rate which is not as transmissible. What does that mean? In COVID-19, if you're affected by the coronavirus, which many are now aware of, cough, fatigue, a runny nose or impact in your respiratory issues. But for monkeypox, it is rashes and fever. And then there's headache. But rashes, which is physical skin reactions, perhaps will be most pertinent to know that you've caught the monkeypox. With regard to COVID-19, of course, people are thinking, what happens next? Vaccines are now easily available. Many of us are, in fact, have got our booster shots as well. For monkeypox, there's no proven treatment yet. But the experts are looking at the smallpox vaccine. Smallpox that has been eradicated from India in 1980, but they're looking at that vaccine if it can be administered as well. But as of now, there is no proven treatment of the monkeypox. My colleague Sneha Murdani, who gave us that special report, is now joining me live on this telecast. It is pertinent, Sneha, that we do this telecast before it perhaps spreads to another level, and that is why for our viewers, do tell us, because they may want to compare this to the coronavirus spread, the COVID-19. You tell us what the experts are telling you about the differences and if this is alarming.
You know, it isn't, I'll tell you, simply put, because the smallpox vaccine, at least the second and third generation smallpox vaccines, which have been used in India as well, Pooja, are believed to be protecting against monkeypox. How do we know that? We know that because monkeypox has been around since 1950s, 1958 to be precise, and there are these antidotes that are available. So to revive the smallpox program, is that something the government of India could look at? Yes, maybe when the cases increase. But mass vaccinations, like in the case of COVID-19, is not advisable. You know, the good thing about monkeypox spread here is that the specific strategy is there for us to see. I spoke to medical experts who say that unless there are multiple sex partners, you really should not be worried about monkeypox. In that sense, we know what really is causing it, so we can stop it. There is much more information available for monkeypox, unlike 3 years ago when we didn't know what really hit us, when COVID-19 was declared a public health emergency and eventually a pandemic in the month of March 2020. So in that sense, we are in a much safe zone if we talk about monkeypox. In the US, let me also tell you that there is an approved vaccine which was approved in the year 2019, and that is being given to the population who have had exposure
where do we
to the
stand
infection.
as India compared to rest of the world when it comes to the monkeypox cases as of now? It's primarily in the African nations. It's already being reported in the US and Europe. Do tell us about that differences if you can.
You know, I'll tell you what, in African nations, this infection has been endemic for many, many years. Why is there a concern now? Because there are countries which have never seen the cases of monkeypox in the past. In so many years, I'm talking about since 1952, have suddenly seen these cases. Hence, the WHO is studying the mode of transmission. We're talking about 4 detected cases in India, but there could certainly be more. It'll be a while before this information comes to the fore and before we get to know about the kind of spread that there is. But certainly, because it is not a respiratory infection, also the infection is not spreading through general contact. Hence, the cases will not surge in that sense. There will be an increase in cases like in the cases of Ebola or Zika, but it will not assume pandemic proportions, is what many medical experts are saying, looking at the information that we have with us right now.
Thank you so much. Sneha Murdani, tracking all the latest. She has been interacting with the top doctors across the country to get us the latest of what monkeypox exactly is. And let's now bring you an expert reaction. Dr. Suresh Kumar is the medical director of the LNJP hospital, where the first case of monkeypox has been confirmed, detected in Delhi. The patient is admitted, is being treated. So let's now listen into what Dr. Suresh Kumar had said. I spoke to him about a short while ago. Here are your questions being answered. Listen in. Dr. Suresh Kumar is back with us. He's the medical director of LNJP hospital, and he's telling us about the first case in Delhi that is currently being treated by him. Sir, glad to have you back. So we were talking about that patient. Now, sir, what are the identifying symptoms that anyone listening to you right now needs to know, that if that is a symptom that their body is reacting, they need to immediately contact the doctor? And is it infectious, sir?
It's infectious. If you have any patient with history of fever and skin rash, and if you have a history of international travel or any travel in the high risk area, number one, if you have the symptoms of fever with body ache, with skin rashes, typical vesiculopustular rashes and painful rashes in the skin, then one must go to the doctor, and as a part of physician and the dermatology team, we recommend that all these suspected cases must be tested for the virus. And we have, in this case also, we have sent the sample from the skin lesions and the blood test to the reference laboratory, and we got the positive report. So this is very important to identify the symptoms, and if patient have typical skin lesions, then one must be having high grade of suspicion on all these cases.
So any sort of rash, any sort of inflammation, they need to suddenly have that caution about. Sir, because your audio is back again, sir, if I can go back to the patient that you're currently treating, and if you can give us a few quick details yet again, that this is not about a foreign travel, there were skin rashes, and now the individual is being treated at the hospital.
It is currently vitals are stable. He is recovering. He had a history of fever 10 days back, and then he has the skin eruptions over the last 1 week. And now the patient is doing very well, and nothing to panic, because the more information about the transmission, about the disease, about the clinical spectrums, the method of diagnosis, how it's tested. So these are all important parameters that everybody must know, and how to protect healthcare workers and all the team, and at the same time how the general public can be more aware about the monkeypox virus, and what are the protective mechanism, what are the precautions that one must take. It is very important to know that it is a droplet transmitted virus, DNA virus, different from the COVID virus, and this spreads from human to human, and we have to wear the mask, and it is very important that we must observe this social distancing, and we must not share the bed sheets, clothes, patients. The close family contact should be avoided if patients have skin lesions and patients have fever, conjunctivitis, and typical features of monkeypox.
How is it different from the coronavirus? Because it's important to understand that we must continue to take similar precautions which Indians are used to now for 2 years. But what can they add to, sir, to ensure that they do not catch the monkeypox as well?
See, the coronavirus is an RNA virus.
Yes.
This virus is different. It is a DNA virus. It primarily involves the skin. And there is no hypoxia or lack of oxygen, or you don't require any ventilatory support or oxygen support in monkeypox virus. In the COVID, we have seen that majority of these patients have cough, sore throat, low oxygen, typical COVID pneumonia, SARI-like symptoms. Here you have primarily the fever and skin problem, and then you have the conjunctivitis, you have the headache, and you have typical skin lesions which are resembling the chickenpox-like eruptions in the skin, and there is a crust formation in the skin, and you have hyperpigmentation, you have umbilicated lesions, and the lesions are mainly over the face, trunk, legs, and on the palms also, which is differentiate from other viral illnesses. So typical classical vesicopustular lesion in the skin differentiated from other viral disease, and it hardly involves the lung.
That's very
Lungs
important.
Lungs are only involved in the immunocompromised patient.
What you're telling us, these are details that our viewers really need to know. So I have now compiled some of the questions that our viewers sent us. We spoke to the experts and also what the WHO and the CDC, the Center for Disease Control, have to say about those concerns. Let's begin one by one for you. Question number 1, what are the symptoms of monkeypox? How can you know that you've been affected? Flu-like symptoms, including fever, headache, and swollen lymph nodes, but also full body rashes and skin lesions when the disease progresses. So skin lesions is when you will know that you've definitely been infected. So how can you take precautions? How can you then steer clear of the monkeypox? That's very important, because that's to avoid any of these reactions. According to the Center for Disease Control in America, it's recommending avoiding intimate physical contact. The CDC had said avoid sexual intercourse with multiple or anonymous partners. Now, who will be then probably at highest risk? According to experts, if you're immunocompromised, then you're bound to be at the highest risk of catching this disease as well. But the World Health Organization has issued a specific advisory for gay and bisexual men in this case. Now, the question is, of course, many are asking if the treatment is available for monkeypox. The answer is, right now, there is no specific treatment is available in India for monkeypox, though there are antiviral drugs for smallpox treatment that are being now used. Now, questions also are, what if you are infected? What if you tend to show all these symptoms? The answer is, you need to immediately isolate, contact your doctor, which means do not self-medicate at any point, something that the experts have been reiterating now for 3 years. Even in the case of coronavirus, you need to immediately contact your doctor. There was a shocking bid to disrupt communal harmony in Uttar Pradesh's Bijnor, specifically at a time when the Kanwar Yatra is already ongoing. Two attackers, take a look closely, donned a saffron scarf and destroyed the mazars in Bijnor on Sunday. The accused were immediately identified by the locals who stopped them. The name of the attackers are Kamal and Adil. Both the accused belong to the Muslim community and were first seen by the local residents while they were destroying the tomb. Now, according to the police, these are two brothers. They carried out this incident by tying a saffron scarf on their head. The police have now taken them into arrest after they were caught by the local residents. Now, police are claiming that this was a bid to carry out a larger communal conspiracy, because the Kanwar Yatra is going on and is also on the same route. Police have added that there was no damage to the religious books, but the tomb's sheets and curtains were burnt to ashes. This comes after, remember, there was a similar provocation at Lucknow's Lulu Mall, where over 5 people were eventually arrested for offering the namaz prayers, or so it appeared, these unknown people in a recently inaugurated swanky mall in Lucknow. The accused, remember, had offered religious prayers on the mall premises and without any permission. That because instigated a massive face-off. Hindu right-wing outfits also jumped in. They also then wanted to recite the Hanuman Chalisa inside the mall. This time, the locals caught them and asked them, what were they up to?
पुलिस की पीआरवी तथा स्थानीय एडिशनल एसपी, सीओ, एसएचओ ने मौके पर पहुंचकर उसका जायजा लिया। तब तक एक और सूचना आई कि दूसरी जगह पे भी भूरेलाल की मजार पे भी कोई तोड़फोड़ हुई। पुलिस वहां भी पहुंची और बहुत ही त्वरित कार्रवाई करते हुए 2 व्यक्तियों को गिरफ्तार किया, जो दोनों व्यक्ति सगे भाई हैं तथा इनकी उम्र लगभग 25 से 30 वर्ष है और इनका नाम क्रमशः कमाल और आदिल है।
Let's go across now to my colleague Abhishek Mishra. He's reporting live from Lucknow. That's absolutely bizarre, but what are you picking up on the details about why did they did this? Why were they trying to destroy the tomb? Because this could have actually led to communal passions. It could have become a law and order issue at a time when clearly tempers are running high.
Well, absolutely, Pooja. And the way this whole crime has been committed, it looks like that, the intent behind this is actually to, affect the communal harmony. And this is what the police is also saying. Both the accused are in the custody and they are being questioned by the ATS and the special team, which is investigating it from the UP police. So that remains to be seen what confession they will make and what will come out in the investigation. But one thing is very clear, Pooja, with the fact that how there has been quite other incidents as well. Recent incident in Lulu Mall of performing the namaz and then all those arrests happening, and this time directly, targeting these mazars. 3 of these mazars were targeted, and even...
What exactly happened, Abhishek? Quickly tell us what exactly happened that led to then this incident, because of course Lulu Mall's controversy is also surfacing over this.
Well, both of these accused are accused of, affecting the mazars there in Bijnor. 3 of these mazars, they went there, they destructed it, and at the same time also set, the chadars and the curtains there on fire. So directly targeting there. And also what is interesting that they went there along with, wearing the saffron scarf. So that is something which is contradictory. So all these elements are being, taken into consideration by the police, and investigation is underway. And the ADG Law and Order has also spoken to us and given a clear indication that, but the things are under control.
Abhishek, keep tracking all the latest, because one only can have a question here. What if the locals hadn't caught them, asked them what they were up to? It could have led to a massive flare-up as well. But that was stopped right in time. Thank you so much, Abhishek Mishra. They are a power couple in the Hindi film industry. Actor couple Vicky-Katrina and Katrina Kaif, but were being harassed on social media, even getting death threats. But there's now been a big breakthrough in this case. Look closely. The individual you see on your screen was actually impersonating Vicky-Katrina, sharing pictures, harassing her. Mumbai police have now arrested the struggling actor Manvinder for stalking and harassing Katrina Kaif on social media. Now, Manvinder is claiming that he was a big fan of Katrina Kaif, but he was jilted because she instead got married to Vicky-Katrina in 2021. Now, the accused lives in Mumbai city. He is now currently under the police custody since the complaint was lodged by Vicky Kaushal and Katrina Kaif. This comes after, specifically, Vicky Kaushal going to the Santa Cruz police station, filing a police complaint against an unidentified man for posting literally a death threat and death threat messages on the social media profile of Instagram of Katrina Kaif. Vicky Kaushal also in his complaint has stated that the accused was stalking his wife Katrina and threatening her constantly. So remember the level of harassment that they must have faced, that they had to then approach the cops as well. Listen in to some reactions that have come in since then.
Here's the deal. There are so many weirdos in every country, okay? And there are so many people playing games, and there are so many people wanting to make easy money, and the gangster style is the easiest because then all you have to do is to send a threat. So these weird people, I mean, there isn't even a reason, right? They have not even given a reason. Have they offended anybody by saying something or doing a film that hurts anybody's whatever sentiments? So this is a new, like a fashion, I suppose, that anybody and everybody can give a threat. And it's unfortunate, but obviously the police has to take the cognizance about this because just in case the threat is real, I think it is fake.
So to understand the extent of how bizarre this harassment and death threat was, take a look closely of what this individual Manvinder was up to. What you're looking at on one side of your screen is Vicky Kaushal and Katrina Kaif, who got married in December 2021. Of course, a wedding that was absolutely secret, and then these photographs came forth. But the stalker decided to Photoshop himself in place of Vicky Kaushal and posted these images of him with the bride Katrina Kaif. Now, there are on his social media profile many similar images where others have been cropped out and he has been standing next in close proximity to Katrina Kaif, and then he started to send out messages of harassment, anger, even literally death threats to an extent because he was angry that he claimed to the cops about why did she marry Vicky Kaushal instead of him. Let's go across to my colleague Amit Tyagi in Mumbai. Mustafa Sheikh. Amit has been tracking the entertainment industry for years now. He's our executive editor. Mustafa Sheikh telling us about the arrest that has been made by the police. Amit, first to you. I'm sure there are enough celebrities that you must have met who face stalkers or similar cases. What do you think happened in this case that the couple had to literally approach the cops and ask for the arrest against this man?
Well, it seems like the life is imitating the art. You know, we've seen many films like Fan
Yes.
and that and all, where the situation was shown on screen, where the actors played, like in Fan, Shah Rukh Khan played similar type of thing happened. But this is like really all the celebrities face this, especially after the social media. On one side, you have the benefits of social media; the actors are connecting directly. But on the flip side, there are the side effects of social media, where the actors get too close to the so-called fan. Their fan clubs, their negative fan club, positive fan clubs, all sort of things. But this is one ramification of the side effects of over posting of things on social media, and I think this is one such case. But all said and done, social media has its own positives and negatives. And in this case, this has led to really a problematic situation for the celebrities. I just came from a shoot with Ranveer Kapoor, and I saw how how people do how actors have to juggle their life. They can't say no to the people coming for selfies, getting too close. So I think for actors, it's a very catch-22 situation how to handle.
It is a tightrope, understandable. You know, who is a fan and who can turn into a stalker with life-threatening consequences, possibly. Stay on with me, Amit, please, because Mustafa Sheikh is going to tell us about the arrest. So this struggling actor, he's been arrested. What are the cops telling you, Mustafa, in this case?
Well, the cops have initially told us that he is 25 years old. He was unemployed, came from Lucknow to Mumbai to become an actor, and he was unemployed. He was staying at a lodge which is near to Katrina's house in Mumbai. So he has been stalking her, and what they're telling us is that looking at the Instagram profile of this accused, initially it looks like it's a case of fan who is in too much love with you, and then after Katrina got married, he took this as a rejection, and then started issuing threats. After a point, it went to an extent of death threats, and hence Vicky-Katrina then approached the Santa Cruz police station. Within 5 hours, this person was located and picked up from Mumbai.
Mustafa, keep tracking the latest on that because, you know, is this love of a fan or is this going way beyond? Because clearly both actors have taken this into account and lodged a complaint. The man has been arrested. Thank you so much, Amit Tyagi and Mustafa Sheikh, for the latest on that. And now the favorite part of 6 p.m. Prime today. It's a special segment, Be Inspired. This report comes in from Kerala. Displaying that disability is not an impediment to success, a Kochi girl, Hannah Alice Simon, added another feather to all the appreciations that she's been receiving because she has secured the first rank in class 12th board examinations in the disabled category. She's 19-year-old. Hannah Alice Simon scored 496 out of 500. She's a student at the Rajgiri Christu Jayanti Public School. She has microphthalmia, which is a condition that results in eventually blindness. Her father is a legal advisor, mother Lija is a school teacher. But Hannah is not just an academic achiever. She's already also a popular singer, a music composer. She has her own YouTube channel. She's a motivational speaker. She's also the author of a book titled Welcome Home. And all of this grit has clearly shown results. She's been awarded a full scholarship to study psychology for undergraduate in the United States of America. Remember, you must be looking at the achievements, but what we know about her now is that she survived bullying during her school days. And today, her success is the answer to all those bullies against her. And now, Hannah joins me on this telecast to tell us and take a few questions. Hannah Alice Simon, you're a class 12th topper in the special category. Thank you so much for joining me right now. What does this success mean to you? And when you look back, how challenging this was to prepare?
I'm feeling really happy now. Getting 496 is a big thing. It's a big miracle for me. All these years of my life, things haven't happened the way I or my parents thought it would. My mother used to say that when I was born, she used to think how I would walk across the room on my own. And now, due to God's grace, I am here as the CBSE national topper among children with special needs. And a Bible verse from Isaiah 42:16, it has been very significant in my life. It says, I will lead the blind by ways that they have not known. Along unfamiliar paths, I will guide them. I will turn the darkness into light before them and make the rough places smooth. These are the things that I will do. I will never forsake them. And this has been so true in my life because the darkness that engulfed me and my parents when I was born has been turned into light, and all the rough places, all the challenges have now become smooth in my life. And I'm so happy. I never expected this score actually. It was totally unexpected, and unexpected surprises are even more beautiful. And another happiness for me is that I am sharing the same score with one of my classmates, Lynette. So when you share something like this, when you enjoy success alone and when you share success with someone, it's a different feeling. So I'm happy to be doing that with her.
Hannah Alice Simon, I think you're absolutely inspiring to me and many others and everyone watching you right now. And more power to you. You have given answers to everyone who thought you wouldn't make it, and more power to you for everything, and all the best for your scholarship as well. Thank you so much, Hannah, and enjoy your celebration and, of course, the big acknowledgement that's come. I'm wrapping up 6 p.m. Prime right now. Thank you so much for watching.